To those of you who are listening to us live on the radio, we're coming out of Ahoskie, North Carolina, 970. I'm actually in Gates County at the nursing home, at Down East Nursing Home. And those of you who are joining us on the World Wide Web, we want to welcome you. We're doing a live radio program as well as live on the internet. So those of you who are local, who would like to watch the program live, you can go to my website, which is askdrferguson.com. In the middle of the page, you'll see a link that says a live radio. Click on that, and then you get to a YouTube page. And on the YouTube page, there's a little house in the top left-hand corner. Click on that, and then click on feed, and you'll be able to catch the program live. So we welcome you to do that, to join us both live and on the radio. Those of you who are catching the program across the world, we welcome you as well. We do this every week from 9:30 to 10. So tell your friends about it. And for those of you local and across the world who missed previous programs, many of them are archived on the YouTube site, which is youtube.com/user/AskDrFerguson. So those are places you can catch some of the programs that have previously run. So on that introduction, we've been talking about the Mediterranean diet and how it fits into a healthy eating and healthy life. We often start the year by talking about things such as that. Our goal for the program is preventive health. And so anything we can do that's going to help in preventive health are the kind of things we want to talk about and things we want to do. So to those of you who are new to us, that's always our goal, to talk about something that you can utilize the moment you get off the air and begin to have better health because of that. And the Mediterranean diet, when I say that word, I'm not specifically talking about weight loss. I'm talking about the way in which you eat. We all have different eating habits, and the Mediterranean diet just happens to be one of the better ones. There's lots of studies associated with the Mediterranean diet, and for those of you who are looking for healthy eating, that's a good starting point. There are lots of plenty of healthy eating diet programs out there. This is one that just happens to have a lot of medical research behind it. They've done research for Alzheimer's disease. They did a study out of, I think it was one of the New York universities. I'm blanking on the name, but they had about 2,000 patients, and they studied them eating the Mediterranean diet and not eating the Mediterranean diet. I think the study went for 8.1 years. And what they found was those that ate the Mediterranean diet on a routine basis had a 40% decreased incidence of Alzheimer's disease.
That's significant.
That is very significant. And it had a statistical significance for those of you who know something about statistics of 0.007. So that means that these results you would not have gotten by chance, except in 7 people per 1,000. And so that makes it very statistically significant. Most times when we talk about statistically significant, you say it wouldn't have happened by chance in 5 people per 100. This was in 7 people per 1,000. So that means that data in relationship to the Mediterranean diet is very significant and very important. They've also done studies in relationship to cholesterol, relationship to heart disease, high blood pressure, etc. Lots of studies using the Mediterranean diet as the platform, and they've had good results throughout these many studies. So for those of you who are looking for a healthy way to start eating, I would suggest the Mediterranean diet is a good starting point. Granted, there's plenty other good diets out there, and many times what you'll find is all the good diets have many of the same items in them, and it's just a crossover. And those items are usually going to be high in antioxidants. They're going to be more natural than synthetic. They're going to be more organic than grown with pesticides. They're going to be things that are going to be more nutritious usually than things that are going to be less nutritious. They're going to be just your better sets of foods. When you, as a quick side note, when you go to the food store, most of what you need, 80% is around the outside of the food store without going down any aisles. And so when you go in the food store, don't go in hungry. Go in with your list, and when you go down a particular aisle, know what you're going down that aisle for. Don't go walking and down each aisle saying, oh, I wonder what I'll try this week. Well, I saw this on television. Oh, I think I'll try that. That's not the way to shop. Knowing that at every corner, before you go down the aisle, those are going to be your items that are either your gimmick items or high in sugar, high in fat, items that have paid more for that shelf space, so they can be right there in your face as you turn the corner. So those are items that you often are going to be items that catch you to try them. Something you might have seen recently on television. As you go down the different aisles, oftentimes the more nutritional foods are going to be the ones that are harder to get to, such as on the top shelf or the bottom shelf, because they know that people that are after good nutrition are going to work a little harder to get their foods.
Oh,
and for example, if you go down your cereal aisle, well, on the top shelf of your cereal item is almost always going to be your best cereals. Your bottom shelf sometimes, but they have the cereals at eye level for the adults and the cereals at eye level for the kids. And those are usually going to be your more sugar cereals. Just as a good rule of thumb, if the sugar has more than 5 grams of fiber, it's probably going to be a good cereal. So you can base it on that. A lot of your cereals that you perceive to be good, if you check the side of the box and see how much fiber's in them, a lot of times it's not a lot. Just as we're on the same topic right now, just throwing out some generalities. When you talk about shopping, fresh is best, frozen's next, and canned is worse. So if you're picking fruits and vegetables, fresh is best, frozen's next, and canned is worse. If you're talking about your juices, like you get the juice out of the like your orange juice, it'll be say concentrate or from concentrate, or if you say it's freshly squeezed, that's probably going to be the better one. But so freshly squeezed, if you got like a juicing machine, if you squeeze it fresh right then and there, okay, that's going to be number 1. Number 2 is going to be the frozen one, and number 3 is going to be the one you get out of the cooler area where it's already in a bottle. So frozen is going to usually beat out the one that's already in the bottle. It takes a little more work to get it out to prepare it, but it's usually going to be the better one for you. Again, the outside of the store is going to be most of what you need. 80% of what you need is going to be around the outside. You go down an aisle with something specific in mind, as opposed to browsing and seeing what's on that aisle. That's not a good way to shop. So we'll talk more about specifics as we go along, but that generality just kind of popped in my head as we were moving along there. Was that pretty clear, Bishop?
Yes, it was. It makes a lot of sense too. I was just thinking, they almost like strategically place what they want to be picked up by the shopper.
Oh, absolutely. I mean, this is called marketing 101.
Yeah.
If you want me to buy something, you're not going to put it in the back of the store.
True.
You're going to have it sitting right there when I walk in the store. So, I'm not saying anything negative about that. I mean, that's just good business. But, the consumer needs to understand how the business is working, and so that they can be a good consumer. So you be a good business person, but you also need to be a good consumer. True. And by being a good consumer, that means you understand what the marketing group is doing to make something more attractive to you. Now, if that item is still attractive to you and it's still a good item to get, well, that's one thing. But if you're just getting it because it was placed at the right place on the shelf, then that's a whole nother thing. So what our goal is to educate our consumers so that when we go to the store, we can shop in an educated way. Another side note, you got to look at your dates. Your dates are critically important when you're going shopping. Everything in that food store should have a date on it. If you can't find a date, you might want to leave it on the shelf. Sometimes they make it hard to find, but everything should have a date. Your bread, your ice creams, your butter, your cereals, your canned goods, everything should have a date. And you want to get the oldest date possible when you're shopping. So reach to the back and get the chicken in the back package. The one in the front package might be right at its expiration date, or maybe a day away. Maybe you reach in the back and maybe you get a few more dates on your expiration. Maybe you're picking milk, and the front milk says, what's today? February 4th. So the front milk says February the 7th, and you reach in the back and you find a milk that says February 12th. And so you get that, and that gives you a longer shelf life. Those dates are suggested sell-by dates. They're really not suggested use-by dates, but we use them that way. They're suggested sell-by dates. So if you buy something and it has an expiration date on it, that's the date by which the store should not be selling it beyond. But that doesn't mean it's not still good beyond that date. So you got to use some wisdom there. Say you buy some milk and you haven't opened it, so you haven't let any additional bacteria into it, and the date that's on the milk has expired. Well, it might still be good. You need to smell it. You might need to do a tiny little taste test, but you can usually tell by the appearance of the milk, by the way it smells. So again, the date on the container is not the date that it's good to. That's the date that they're not supposed to sell it after. And people mix that up all the time. And they look at the date and they say, oh, it's got February 3rd on it. Today's February 4th, so I better throw that out. No, not necessarily. That's not necessarily true. Now, it may be true. So I'm not trying to tell you to keep stuff that's expired or stuff that's not good for you. I'm just telling you that the date on the particular product is not the date that it's good to. It's the date that they have to sell it by. And that makes a difference. It makes a difference. Because some things will last longer, and if you're going to freeze it, well, obviously that date that it has on the container is going to differ. You know, I learned a little tip just about a week ago. It was an interesting tip. I was talking to one of my patients, and he was having some shrimp, and he was catching them fresh, and he was saying one way you keep the shrimp on longer, kind of indefinite, so that it doesn't get freezer burn, is that when you first get it and you put it in a container, you surround it by water. So you submerge it in water, and so then you're freezing it in a block of ice, and it doesn't get frostbitten that way. At least that's what he told me. And it sounded like it made sense.
It sounds like it makes sense.
All right, and so I don't know what other foods you can completely submerge in a block of ice, but that was one of them. He said, that works well. I'm sure there's some foods that it might become waterlogged if you do them that way. This depending on how close. I guess if you freeze it already and get it partially or almost frozen, and then submerge it in the water, then it probably wouldn't become waterlogged, because the water wouldn't be able to get into the item that's already frozen. So that might be a good way to do things. I'll have to experiment with that. I have no knowledge of this personally, but this is something one of my patients told me. So I always take information. I think it's good to assess and evaluate information and see how well it works.
Indeed.
In reference to the shrimp, but it made perfectly good sense. They already got a shell on them, and you submerge them in the water so they don't get frostbitten. And frostbitten, when you still have something to freeze, that's when you get those white edges on it, and you pull it out of the freezer and it's got white areas. Well, that means that particular item has been frostbitten. And that's probably not your best item to take once it gets to that point. But what's the time limit on how long something can stay in the freezer? It matters how well you put it in there. It could be 3 months, it could be longer, but I think it matters on the preparation that you took in putting it in there, how it's been frozen, whether the freezer's been opened and closed, or whether it's just been straight closed all the time. All of those things play a factor in how well something can be preserved in the freezer. So again, generalities, but you want to pay attention to that. Just want to put something in the freezer and leave it in there indefinitely, particularly if you didn't put it in there correctly.
And there are a lot of advertisements now showing things that you vacuum seal.
Those vacuum seals, Yep, that definitely decreases the incidence of frostbite when you do the vacuum seal. And those are good things to do, preserving things. You can buy those vacuum machines for home. It's a little. You can buy the little bags, and it's a little hose you hook up to the bag, and the bag kind of sucks the air out. The hose sucks the air out, and then it has a little thing that comes across and seals it. So you can definitely buy those for home, and probably a good technique if you're going to be freezing stuff on a routine basis. So we said we're going to be talking about the Mediterranean diet today, and so far we've just kind of talked about generalities. But let's get to the Mediterranean diet. For those of you who are listening locally and you'd like to catch us on the internet, you can go to AskDrFerguson.com, click on the little icon in the middle of the page that says Live Radio. When you get to the YouTube site, up to the top left-hand corner, click on the little house and then click on feed, and you'll be able to catch the program live. And we've been catching, more and more people have been catching the program live from throughout the world, and I appreciate that, and I appreciate that vote of confidence for all of you who are joining us across the world to share this information. But those of you who want to join us locally, if you do that, just make sure you turn your radio off, because otherwise you're going to get a significant feedback when you have me on the radio as well as on the YouTube. So when you talk about the Mediterranean diet, there's some basics things that are involved in there. And what I like to do is start with looking at the Mediterranean diet in the form of a pyramid. You know, many of you remember the old dietary pyramid and the things that were in it, and the way it was structured. Well, some folks have taken the Mediterranean diet and kind of done the same thing with it and put it into a pyramid form. And the pyramid kind of helps you understand how often you should take a particular part or one of the particular items that are associated with the Mediterranean diet. Now, in this particular case, the pyramid, at the top of the pyramid is a few times a month. That would be red meat. Right beneath that is sweets. Again, just a few times a month. Beneath that is poultry. And beneath that, well, you'd have eggs, and then you'd have the chicken. And so those are a few times a week. So a lot of people say they don't want to eat eggs because they're high in cholesterol. Well, every cell in your body has cholesterol in it. So you do need the cholesterol, but everything you need a balance. Balance is the key to preventive health. So the eggs 3 or 4 times a week would be okay. And then chicken several times a week, also okay. The next, you have fish. And fish is right about once a day, somewhere between 5, 7 times a week. And fish, when you take fish, cod, mackerel, salmon, trout, all of those are going to be good fish. Even herring is a good fish as well, but not salted, the fresh herring. You know, a lot of times in the past, when I first moved to this area, everybody was eating these salty herons. And I was trying to find out, why is everybody eating these salty herons? And everybody talking about how good they were. Well, they're totally loaded with salt because they were preserved in salt. And what I learned later was what happens is they sell the fresh herring off right away because they get so many in their nets. And then what doesn't sell right away, they salt it down so that they can preserve it. Now, I don't know about you, but I'm not as interested in eating no rotten fish that got preserved in salt. Now, clearly, I'm sure they preserved them before they got rotten, but you understand my point.
Yeah.
That the reason they got salted in the first place is because I couldn't sell them all fresh. If I could have got rid of them all fresh that same day, I would have never got to the place of salting them. So for those of you who like your salty herrings, just be careful, because they may have been on the downside by the time they got salted. You know, I haven't heard so much about salty herrings in the recent past. I think with all the information about healthy eating and healthy diet and decreasing your salt intake, I think all of those things have probably played a big role there.
Probably. So there are just a few places now that sell them.
Right. But, you know, as we're talking about salt, there's lots of misnomers associated with salt. Every cell in your body has salt. It's in the form of sodium chloride, NaCl. So your body has to have salt to function properly. And so when you start eliminating the salt shaker and things like that, sometimes you make it more challenging for people, particularly diabetics, things like that. They may eat worse and may begin to lose weight when you take the sweets and the salt out of their diet. They did a large study with some geriatric patients, and they found that they were comparing a regular diet to a diabetic diet. And the diabetic diet would have been low in salt as well as low in sugar. And what they found was the patients that were on the diabetic diet did worse than the patients that were on the regular diet. Now, these are diabetic patients. And one of the reasons they were surprised with those results, because they thought the diabetic patient would do better as far as their blood sugars are concerned. One of the things they think happened was the diabetic patients didn't get good food on their tray, so they would constantly try to maybe get a piece of cake or something off of somebody else's tray. Where those that were on a regular diet, because they were getting the cake and the different things on their own tray, they didn't have a desire to have to go find somebody else's. And so we don't know for sure, but in that particular study, a regular diet was better for the diabetics than a diabetic diet. And so that's just a little side note there. And again, our bodies are wonderfully made, and in moderation is what we need. Granted, you don't need to dump the salt shaker on your food, but every cell in your body has salt in it. So you have to continue to have some salt in your diet. And a lot of times, if you just cook with some salt and you don't add any extra salt at the table, that might be sufficient. But by the same token, salt has got a negative rap for the most part. And some of the larger studies in relationship to high blood pressure and salt, they had maybe a 3-point drop. And I say 3%, but a 3-point drop in those that were having the low salt diet and those that were having the regular salt diet. When we say low salt diet, that means less than 2 grams of salt per day. So there's lots of data out there, and I'm not interested in getting involved in the controversy. So I'm not going to say any more about that other than to say that your body has to have salt. So don't try to eliminate salt from your diet. You might use it in cooking and maybe not put an additional one at the table. But every cell in your body has to have salt. So that's just another little side note there. Now, as we're talking about the Mediterranean diet, where I think we made it about to the middle of the pyramid. By the time you get to the very middle of the pyramid, that would be cheese and yogurts. Cheese and yogurts are a very common thing in the Mediterranean diet, and they're done just about every day. And so now that's a daily item, cheese and yogurts. And a lot of times, those that eat that way will do things like cheese and yogurt as their snack, as opposed to the Western culture, which as our snack, we get a snack. Chocolate cake, ice cream, cookies, candy bar. But in those that are kind of hanging and doing strict to the Mediterranean diet, their snack might be cheese and crackers.
Yeah.
So that varies a little bit. Now we're down below the middle of the Mediterranean diet, and there you'll find olive oil. Extra virgin olive oil would be the suggested one. And they use olive oil for just about everything. They use it in cooking. They use it as salad dressing. They use it to grease the pan. They use it just about everywhere. So it can be utilized in many, many different categories. We're almost down towards the bottom now. The last two layers on the pyramid are going to be fruits, vegetables, and legumes, so the nuts, the berries, the beans. So that's just before the bottom on the pyramid. So those are several helpings of that a day. And then at the bottom of the pyramid, you have your rices, your dark breads, your nutty, crusty breads, things like that. And so that's on the bottom of your pyramid. A lot of times you hear people talking about not one breaks is fattening, it's causing them to get fat. Well, again, you want your body is wonderfully made, and it needs everything. It needs carbohydrates, it needs fats, it needs proteins. And all of those things have to be in harmony. So when you're going to pick these foods, if you pick the better foods, then you'll have less problems with the foods you pick, such as bread. Remember I talked about cereal. I talked about having at least 5 grams of fiber on the cereals. Well, when you're talking about breads, I would suggest you look for at least 3 grams of fiber. And if it has 3 grams of fiber for the bread and 5 for the cereal, it's probably going to be a reasonable product to have. But that I do definitely suggest that a person looks at the label to see how much fiber is actually in that particular item. Am I making sense, Bishop?
Sir, I'm listening. So I think that before I mentioned that when I go to buy something, that's what I look at. I look at especially the sugars and the carbohydrates.
Uh-huh.
And it makes good sense, good shopping sense.
Right. So yeah, these are just little tips that we hope will help all those in our listening audience to be better consumers of what they're going to eat. So again, you can always reach me at my website at AskDrFerguson.com. You go to the YouTube site, youtube.com/user/AskDrFerguson. Many of these programs will be archived there. You can always call the office at 252-332-6484. We're always happy to see new patients. We do lots of different things in our medical practice. We enjoy preventive health, but we also do a lot with hormone balancing. We do a lot with family practice in general. We do a ton with Alzheimer's disease. So lots of different other things we really enjoy doing. And we do welcome our listening audience to call and make an appointment or just a consultation to find out about something. And then you can see us, we can give you the consultation, then you can go back to your previous healthcare provider. But we do ask that you continue to be wise in your healthy choices. Make sure you do have a healthcare provider. Make sure you are getting some guidance, some direction from somebody in that field. Don't just go into it blindly and grab everything you see that's advertised on television. Some stuff's good, some stuff's not bad, and your healthcare provider may not be on top of preventive health or natural things. And then, maybe seek somebody else for that information if you like their care or her care. Then go back to that healthcare provider for the care they've been providing for you. So I think that's important that you kind of have a handle on that when we're talking about healthy eating. So I know we're getting closer to an end, Bishop, but I always never want to leave out without talking about water. when we talk about healthy living. That kind of overlaps any aspect of healthy living. Men, 65% water. Women are 55% water. Water, 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 water. You don't want distilled water, and you don't want distilled or sterile water. You don't want either one of those two, unless maybe you're on a fast, you're really trying to cleanse your body of everything. In that setting, those two might be okay. Excuse me for yarning. But if you're not in that setting, those two are not going to be okay. So one of the waters you can buy over the counter. And again, unless you have the water tested, I could not sit here and tell you that any of the waters over the counter are going to be better or worse than the water you get out of your tap at home. Just couldn't tell you the answer to such a question because water differs greatly. And so water is critically important to healthy living. Those of you who are average weight and height, 64 ounces of water is a half a gallon. And that's about how much the average person that's 150 pounds needs to, on a daily basis, to sit on the couch and watch TV. If you go out and sweat and do more than that, you're obviously going to need more water than that. And I can't overemphasize the importance of water. Water is going to help with your complexion. It's going to help you move your bowels. It's going to help you feel better. It's going to help with headaches. It's going to help with your skin feeling better. Water is a very, very, very important part of who we are. And as I've told you, men 65% water, women 55% water. That's still a lot of water. And even when you talk about your muscles and your bones, your muscles is 70 to 75% water. Even your bones are 25% water. So who would have thought that your bones had that much water? Your brain, 75 to 82% water. Your bloodstream, 75 to 82% water. I know I've said it in the past, that statement, the life is in the blood. Well, blood is more water than anything else, 82% water. So as we come to an end today, I just want to emphasize to our listening audience that preventive health is something you do on a daily basis. It's not something you wake up and you say, oh, I got to get into this bikini, or I'm in a wedding next week, or, I just want to do this. That's not how you do it. You got to stay consistently, and you got to keep driving towards the mark.
And especially during this time of the year, we have to be sure we drink a lot of water.
Absolutely. So for those of you who want to reach us, you can always call the office, 252-332-6484. You can go on the internet, AskDrFerguson.com. You go to youtube.com/user/AskDrFerguson. All those are places you can reach me. If you forget all of those things, just type in Stephen Ferguson, MD, or Stephen Ferguson, or Ask Dr. Ferguson in the Google search window, and you'll get me. And I always want to tell people, don't forget, Talk Back Now with Patricia. She'll be coming to you live in just a couple. I think she starts from 11 to 12 today, and then on Friday she goes 10 to 11. People tell me how much they enjoy her program and how much they learn from it. So I encourage all of you who enjoy my program to also tune into hers. On that note, be blessed and have a wonderful day.
Thank you. You too,
All right. Bye-bye now. And on those of you who are listening on the World Wide Web, it's nice of you to join us. It's nice for all of those of you who have joined us from near and far. Don't forget, each week from 9:30 to 10, we have our program. We're always talking something, preventive health, and the information you can take and utilize immediately. Keep another thing, just as a quick side note, keep the poison control number close by, particularly when you have small kids. If they get into something, you want to dial that number and ask the poison control what you should do. So there's certain numbers you should have right by your phone: 911, poison control, the nearest hospital, your doctor's number. All of those things you should have close by, so in case you have an emergency, you can tap into those immediately. So on that note, I'm going to say to all of you and our listening audience to be blessed and have a wonderful day.